showing a video on how to clean and medicate your dog's ears. It's a common problem in dogs with skin problems, and the ear itself is lined by skin. This is Islin, and she has skin problems, so she produces a lot of wax in her ears, and it can cause an infection, which we see often. We often see here at Dermatology some allergy patients, and like people that produce too much mucus in their sinuses, dogs' allergies are directed at the skin. They produce too much wax in the ear canal. Just to show you what the ear looks like in the dog, very different than the human. The ear actually, and this would be if you look at her from the side, what the ear canal actually looks like. So her nose is pointed that way. Their ear canals are lined with skin, and their ear goes down vertically and then horizontally. So on the dog's ears, it's actually like backward L's on both sides. This skin is lined by the wax glands, and this gets irritated and inflamed when there is allergy or other skin disorders, and this wax is overproduced, and that affects this canal. And with time, that inflammation can thicken the canal, just like a person's sinuses with allergy, and damage and close it, causing infection, and it's a good media for the bacteria and yeast to live there, to start to cause problems and pain and odor. Oftentimes when an animal comes in with general itching and problems, owners aren't even aware that the ears are involved because they can't see it until it gets a little more further down the line, more advanced, when there's pain or swelling or odor or shaking the head. So what we want to show you is how to clean the ear properly and how to medicate. There's many different ways, and you may have learned different ways, and it's not wrong, but once there's a problem and they have sensitive skin, we're going to be very careful, and then we're going to show you how we like to have it done. So basically, what we like you to use as the cleaner, we want to use a product that's really soft. We don't use cotton balls because if the ear skin is a little bit pebbled or rough from the skin disease, it can leave the little cotton fibers down into the canal and act as an irritation. Our favorite is gauze that's a soft 4-ply gauze. It's not the scratchy, porous gauze which can irritate and injure the ear. You could also use a face cloth. Has the good consistency. When it's wet, it's pretty soft. Or a baby's face cloth if you have a small dog, a small dog with small ear canals. We like the gauze because if there's debris in there or infection, you can just throw it away as we're going. So we've pre-soaked it with water, warm water, because we want this warm. It's uncomfortable to put something cold in the ear. And it's not drippy, so we shake it out and squeeze it. We do not want a lot of water going into the ear canal. We then will take our cleaner and we'll put a little bit of cleaner on the gauze. We do not like the cleaner going into the ear canal. There's nothing wrong with cleaners that are labeled to use that way, but it's messy. The dog shakes their head. We're trying to prevent shaking the head and irritation from an already irritated area. We only put a little bit of cleaner, like the size of a quarter, on this entire stack, and then we go ahead and take one at a time, and we'll actually clean the ear. The dog's ear, this is cartilage up here, will actually hold the ear. We like the dog's head to be straight because if she puts her head up or down or sideways, she's going to twist this canal, making it harder for us to get access in there. And basically we're teaching you how to clean inside the ear flap and down in here. We don't want you going down in this area if you pull the cartilage, going down into that deep area. So we're showing you how to work up here. In an allergic dog, the ear cleaning is altered, which is why we're showing you how to clean. In a normal ear, the skin cells move up like a conveyor belt and bring the wax up and clean itself. And that happens in the human ear too. So dogs' ears are constantly cleaning themselves throughout the day. In an inflamed ear, that cleaning mechanism is altered and stops. So that's why it's important to clean. And so we take one gauze at a time, and Dawn is holding her head straight and kind of reassuring her, because she's very shy, and we go ahead and we gently take her ear flap. We did remove some hair just to make it a little easier, because she's a dog with a lot of hair, and that hair can impede ventilation, visualization, and medicating. We very gently, and I'm pushing on the back of the cartilage here. You can gently push because there's all these little furrows and crevices in here, and we're gently wiping upwards away from the canal. Reach down into the canal as we gently pull up on the ear, and we use it like a spoon. We're pulling debris up, we're not pushing it down, and you'll get some debris, and then we'll toss that, and then we'll get a new one. We just keep getting a clean one as we go. Sometimes there'll be a lot of debris if the dog comes in with advanced disease, and we'll actually go in and blot that and reach down and going. And if an animal has had ear disease for a while, those canals are going to be a little bit tighter. Even this area here that's just nice and soft, again, it's cartilage like our ear, could turn to bone or get thickened or have discharge, and then it's much more painful. Then we'll use Q-tips on the part that you can see, and then the upper part, if they'll allow you. It's fine to just use the gauze too, because we don't want to break the Q-tip. And we'll just go in and gently push and try to get some of those crevices, because sometimes we'll see debris stuck in there, and we can go in and just kind of further clean it out from here. So basically that's the safe, gentle way to clean our ears. And then we get to the part of medication. And depending on the size of the dog, how much medication, and it's important in a dog this big that we're treating the entire ear. And that means this part here, and then down into the, you can see it better over here, and then down into here, and then at the end we massage that medication to go down into this canal here. And again, here's the eardrum here. This is the middle ear and the inner ear, and we don't want damage to get into the inside where the dog would have balance problems or hearing problems, which can happen from chronic ear problems. So then we get to the medication part, and again, there's many different medications. Some are going to be thickened or may have color, some are liquid. And in a dog her size, we may send you home with medication drawing up in a syringe if we want a large volume. And remember, we're trying to get that whole surface area. That's the ear up here and down into the canals. This is the ear flap, or medically what we call the pinning. And so what we'll do is, again, her head is straight. We'll take the medication, and we want to get it down into this zone here. So we're going to go right into the opening, and we're not going to push this into the ear canal. We're just going to gently be above it, and we generally will put half of it in there. And it tickles, and it's a little cool. And then we want the rest of it to go in this middle part and then up onto the ear flap itself. And then what we'll do is just gently close this and gently sort of fold it. And then more importantly is to grasp this area here and massage this. So we're getting the medication to go down into this area, which is going to have more disease because it heals kind of from the top down. So we want to make sure we get it down to the bottom, and that's really important. And then you want to have, dogs can be nervous, so we're going to go ahead and give her a treat. And give her, you might want to have your treats out and reassuring them. And so we'll give her a cookie. She might be too nervous to eat it.
We want cookies too! Can we have cookies too?
She's too nervous to eat it. So that concludes our video for cleaning and medicating the ear. Thank you. So during your pet's dermatology exam, part of that exam of the skin is to look at the ear because it's lined with skin. And this is a video otoscope that we'll use. So we're looking down into that ear canal and magnifying it. It's like doing a colonoscopy. We're doing otoscopy, looking into that ear canal. So we'll go ahead and first take this and look at the inside of the ear flap. And on the screen there, you can appreciate that she has a little bit of redness and a little bit of bumpiness because she has skin disease, but a lot better. And then this is the debris in here that we need to clean out. And we may need to go in under anesthesia and take some of this debris out. This should be a nice, clean, open tube, and she's overproductive, and I can't see the eardrum, so this is an animal that we may need to use anesthesia if it doesn't clear up with topical therapy.